Hello, and welcome to the Science on 7th live stream where we talk about topics related to air quality and health. I'm your host, Pallavi Pant. Air pollution is a problem around the world, and as a result, there are a variety of ways in which people are tackling the problem, both from generating data, understanding which solutions work, to implementing those solutions and designing policies. And one of the ways that we keep informed about how these developments are happening, where they're happening, what we're learning from them is through meeting places and conferences and events. And we have one such very interesting event coming up next week called the Clean Air Forum, which is an annual convening for the communities of practice in Africa, trying to create a space for knowledge exchange, collaborations, and partnerships to tackle the problem of air pollution in African continent. This will be the third year for the forum, and we are very excited to be a convening partner together with AirCo, which has been serving as the host for this conference and the forum, as well as many other organizations that have contributed in a variety of ways. We are expecting over 250 people at this conference, at this forum in Nairobi next week. And we thought it only fitting to spend today's live stream talking about air pollution in Africa. And I have a couple of fantastic guests to tell us more about both the problem, the new science that is happening, and the ways in which governments are tackling the issue. So first, I would like to welcome Dr. Evelyne Touré, who is a researcher, works on issues related to atmospheric science, air pollution, climate, and health. She works at the University Félix Houphouët-Boigny, I hope I got that almost right, in Côte d'Ivoire. She has partnered with a range of people across the world on trying to create and generate better data. And she also serves on the advisory panel for the Climate and Clean Air Coalition. So welcome, Evelyne. Very happy to have you here today. I would also like to welcome Dr. Tunde Ajayi, who is the General Manager of the Lagos State Environmental Protection Agency, or LASEPA. He's a trained physician, a public health specialist, and has a business degree. And he's worked on a whole range of issues related to health at organizations including the World Health Organization, the Center for Reproductive Health Research and Innovation, as well as his role over the last few years at the Lagos state government. And at LASEPA, he's leading the charge for a cleaner, healthier, and pollution-free Lagos. So Dr. Ajayi, welcome. Thank you for joining us.
Thank you. Glad to be here.
Wonderful. So, Evelyne, I will start with you. We know that air pollution is a problem on the African continent. We hear these statistics about really high exposures, about more than 1 million deaths occurring on the continent. But what is it that makes the story of air pollution unique? What is different about the continent? What are some things that set it apart from the same problem elsewhere?
Okay, thank you very much. Thank you for giving me the opportunity to be here. I can say that the air pollution is one of the major challenges that the continent is facing currently. And from the report, the various reports, is estimated that 923 million people in the sub-Saharan African only are affected by the air pollution. And in this air pollution, which come from different sources, the transportation, the cooking, and over the industries, we have overall about is estimated to 1.1 million of people who die of premature death in Africa due to the air pollution, and this represents about 16% globally. But in what makes the African country being so special is that we have sources such as Sahara desert in the northern Africa, but also the Kalahari desert in the southern Africa, which are source of a lot of pollutants. But we have also, with the way we are industrializing the modern life that we have also producing new sources that are also affecting the air pollution around us. And one of the cooking, for example, which is I can say the basic need of all human beings, because we need to feed every day. We don't have access to clean cooking system, so people are still using solid fuel, and all these solid fuel affect also the environment, which environment and also the health, but it also affects the kids that we have at home, because in Africa, most of the people in the kitchen are the women who are cooking with the young children when they do not start yet school. So they are with the mother, they are also affected. But we also have the transportation, which is one of the major sources in Africa, in the sub-Saharan. I will focus on sub-Saharan Africa because I think this is one of the major points. And the transportation system also is one of the, we don't have reliable overall, maybe a part of South Africa, which is a bit different. In most of the countries, we don't have a reliable, good transportation system, which make also the poverty that is making people go to buy the second-hand car, which are outdated in terms of emissions. So all these are really impacting the way our lifestyle and the urbanization, which is not always well planned. All this system is impacting the air pollution and also the human health and also the ecosystem, because the ecosystem are also impacted by the air pollution. So to not be too long, I think I can stop here, then we can have interaction if this is.
Yeah, thank you so much. I think you're, raising a lot of interesting points. And Dr. Ajayi, when I think about, some of the issues Dr. Touré mentioned, thinking about Nigeria, one of the most populated countries, really large. Lagos within that is, one of the Lagos city itself, a big, vibrant city undergoing urbanization, large population. And as the person leading the charge at La Cepa, you've been showing very strong leadership on air quality action. So I think I want to ask you a two-part question. One is, how did you decide the focus should be on air quality action? Because this is something we do struggle with in a lot of places, making air pollution an important enough issue. And then also, if you could tell us a little bit about some of your initiatives. I think we have some graphics here as well to showcase how La Cepa has been communicating, but would love to hear from you about what motivated this action and what are the types of interventions or actions you're taking at Lagos. I think you are on mute. So if I could ask you to unmute yourself.
Okay, I apologize for that. So for me, on this side of town, Lagos is Africa's largest mega city with a population of over 20 million. A population explosion ordinarily will come with pollution. So you expect that everybody or every human being generates waste. Along the lines of all of the air pollutants streams that Evelyne initially highlighted, from cooking emissions to vehicular emissions to industrial emissions, in Lagos we see huge quantums of all of these things. And my background as a medical doctor, as a public health professional, makes me more sensitive to those things. The second reason is that when you're measuring impact of any activity you're doing, for me, it's easier to draw a correlation between air quality and health. Again, because of my background and because of the exactness results, because of the results that you see, the visible results you see. For instance, studies from 2020, 2019 shows that about 23,000 premature deaths happen in children under 5, and that is from air pollution. So a lot of the children who are exposed to poor air or bad air will fall sick and die. So I thought it was important to pay a lot of attention to it. And along those lines, I have, along with my team in La Cepa, we have been able to champion a lot of initiatives, from making sure that the sensitivity and the documentation of air quality is raised. We have gotten a lot of research activity and grants in this line. We're partnering with more people now to document air quality and, make it seen. On the other hand, we're also creating a lot of interventions, so to the places where we have poor air quality, the cooking emissions from the major cooking hubs, where you have women roasting fish across town. We're putting kilns in place so that you reduce the emissions, you make their socioeconomic life better. You're also helping the health of the women. So you can measure the impact of, combating air pollution by just doing one intervention, two interventions in specific pockets of places, right? So all of these things put together are the reasons we continue to do the work.